Welcome everybody to the second webinar in the series hosted by Human Rights to Water. I'm Amanda Loeffen and I'm your host for the webinar. As evident from the name, our mission is to support the integration of the human rights to water and sanitation into law and policy. The role we have to play is a complex mix of creating awareness of the rights, as well as know-how about pragmatic and practical solutions related to international standards and norms. Today, along with the Special Rapporteur, Léo Heller, we are celebrating the 10-year anniversary of the recognition of General Assembly Resolution 64292 on the 28th of July 2010. We'd like to show positive examples of countries where there's been a strong effort to integrate these rights into governance. It's early days to expect full compliance and realization of these human rights, but it's commendable that both Mexico and Kenya are countries that have dealt with more than their share of difficulties in terms of water availability, and yet they're two of the most advanced in terms of forward thinking and integration into law and policy. Less than 30 countries in the world have explicitly recognized the human rights to water in their constitutions, and that's merely a first step. The main message that we'd like to get across is that it's imperative to build human rights to water and sanitation into not just the Constitution, but also international water programs and plans, local policies and monitoring programs. We're blessed with a rich panel of speakers today, of whom all are experts in the fields of human rights, water and sanitation. Starting with an introduction from the Secretary of our board, Callum Clench, also the Executive Director of the International Water Resources Association, who will set the scene with a perspective from IWRA on how they work to promote good policies on water. We're then honoured to introduce Dr. Blanca Jimenez, the Director General of CONAGUA, the National Water Authority in Mexico. Mexico has taken the lead in Latin America with their very forward-thinking new national water program and the adoption of the human rights to water and sanitation. Dr. Jimenez will share with us some of the strategy that sits behind this new instrument. And moving to best practices in Africa, we're also pleased to welcome Maureen Mwadime, a senior expert from the Kenyan National Commission on Human Rights. The KNCHR has been quick to adopt the new framework for monitoring the human rights to water and sanitation, and Maureen is able to share with us some of the learnings and challenges. After these two countries with good practices, Sergio Campos, Chief of the Water and Sanitation Division at the Inter-American Development Bank, will enlighten us with some background on the strategy that the IDB is taking to support human rights. We finished the panel with the current Special Rapporteur for Safe Drinking Water and Sanitation, Léo Heller. Léo is an expert in formulating policies, teaching and research in the field of public policy and management and of environmental health related to water and sanitation. As Special Rapporteur, he has had the benefit of researching and visiting many countries in the course of his responsibilities, which give him great insight into how these human rights have progressed over the last 10 years and where we need to go from here. We'll then open for a Q&A for the attendees to ask questions through the portal on Zoom. Please feel free to write a question to the panelists and we'll do our best to answer them during the webinar. In case we don't have time to answer them all, we're making a commitment to follow up with a summary of the webinar with questions answered. This will be available on our website next week, so please check it out. Without further ado, I'd like to introduce Callum Clench as our first speaker. Callum is currently the Executive Director of IWRA and is a policy expert in sustainable development and business practices, with a particular focus on water and economic development.
Hi, thank you, Amanda. Thank you very much for inviting me to be on this board. It's quite an honor to be here. I'm not a human rights expert, so I'm sort of a bit humbled actually in a way. But I do know a few things about water. And as the Executive Director of IWRA, I also have access to a number of experts in various fields of water, both science and policy. So I've been talking to them in advance of joining this board to try and pick their brains of things to say and to present the IWRA perspective on this issue. You've also had the chance to hear from one of our board members, Raya Stefan, at the previous webinar, and Blanca Jimenez is also our vice president, so I feel like IWRA is fairly well presented here. So thanks again. What I'd say is integrating the human right to water and sanitation into law and policy is something that IWRA is certainly interested in. And as we work at the interface between science and policy, we're looking to ensure that robust science informs strong policy, and that policy drivers also inform the focus for ongoing and future research. And we do this through a number of ways, including through our World Water Congress, as well as through our journal, Water International, webinars, policy briefs, task forces, and so on. So if anyone's interested in more of that, please contact me after this webinar. I delve into it, I think it's impossible to talk about anything these days without referencing, unfortunately, COVID-19. And one of the clear messages that's come out of the COVID crisis is that it has exacerbated the pre-existing need to realize the human right to water and sanitation for a minimum hygiene, such as washing hands. So millions of people globally don't have access to clean water, and so they're not able to do that simple act of washing their hands to protect themselves. As a result, they are especially vulnerable to COVID-19, and this is especially worrying for developing nations, but also for indigenous communities worldwide, where water systems are inadequate to meet their needs. In order to address and overcome this pandemic and to access the clean water is critical. So this is the science. The access is the science, and the human right to water is the mechanism, it's the policy that, if more broadly recognized, could be an important tool for preventing and minimizing the impact of such pandemics moving forward. So with that in mind, what are the challenges from a policy perspective? Firstly, we need to adhere to sort of three basic principles to assess what we mean by the human right to water for human and for personal and domestic uses. So we're talking about availability, quality, and accessibility. So by availability, what should be the minimum per person per day requirements? And estimates, depending on your source, vary from, say, 20 liters to 50 liters a day. Quality, is it safe and free from harmful substances, such as microorganisms, but also chemicals? And this is, from a policy perspective, becoming quite a challenge, particularly with pollutants of emerging concern, especially things like pharmaceuticals, both human medicine, but also those pharmaceuticals used in livestock. And then accessibility, and this refers to the physical as well as affordable access that people have to safe water. And we need to ensure that this is provided on a non-discriminatory basis. So these are the basic requirements. It's important to note, though, that within these discussions, we find that while the right to water is addressed, the right to sanitation is often forgotten, or it's downgraded to a lower priority, which in itself can have a negative impact on that access to safe water. And indeed, actually, where I am right now, we have no sanitation in this building because of plumbing issues, which will last for 24 hours, but it feels like your world ends because I live in a privileged European environment where we take this thing for granted. So it sort of feels kind of timely given this webinar. So merely outlining those basic requirements is, of course, it's not enough. States also need to help their residents to realize these rights. Is that okay, Amanda? Yep. I can't hear you, but okay, I'll continue.
Just worry, just keeping an eye on the time.
Okay. It is generally agreed that states also have to help their residents realize these rights, and it's generally agreed that there is an obligation to guarantee these rights unless it's impossible to do so because of armed conflict, or also because of constraints on the resource itself. And this second part can lead to fairly slow action, unfortunately. So when discussing the human right to water and sanitation, it's also important to consider things like balancing this with environmental flows. And with the Sustainable Development Goals, we all agree that water needs to be managed sustainably, while progressively providing access to populations, human populations. So this leads to the state obligations around respecting, protecting, fulfilling the human right to water. So by respecting, we usually talking about respecting the traditional access and use of the existing water resources. while protecting residents from infringements, usually often from third parties, and fulfilling rights by using legislation and the judiciary and other measures to realize rights for individuals. So sort of just to finish, what we're seeing now is that the human right to water is being expressed not only through these sort of international conventions, but through various domestic laws. However, what's interesting to note is that it's not always explicit, and it can be expressed often indirectly through other laws. And one example would be the Indian constitution, where you have the right to life, but that doesn't specify necessarily the right to water. But how can you have the right to life without access to safe water and so on? So the final comment would be, moving forward, we need to ensure that we're more explicit about the human right to water and sanitation in legal mechanisms and policies. And we also need to continue to protect vulnerable groups. This includes looking at environmental protection, recognizing the vulnerability of those who are disproportionately affected by environmental degradation, and the impact that this has on their access to safe water resources. So that's a lot of information in 5 minutes, but hopefully that gets the ball rolling.
Well, thank you. Thank you, Callum, for your insightful presentation, which brings our attention to the close connections between water science and policy. I'd like to move to our first speaker today, Dr. Blanca Jimenez. Appointed as Director General of the National Water Commission, CONAGUA, in 2019, she was also the first woman to be appointed as Director of the Division of Water Sciences and Secretary to the International Hydrological Programme, IHP, in UNESCO from 2012. Serving as Vice Chair of UN Water from 2014 to 16, Blanca is well placed to bring both a global and national perspective to the progress made by Mexico in the last few years. I can pass the floor. Blanca.
Good morning, everybody. Thank you very much, Amanda, for your presentation. I would like to say some very practical issues, maybe concerning the human right to water. First of all, as many countries in the world, Mexico incorporated to our constitution the human right to water and sanitation since February 2012. And since then, the water community has been fighting among them in order to make this right a reality. It looks like water is being more an object of discussion rather an object to do something. When I took this position, I started to work on the idea on how to implement the human right to water. And for that, it's very evident, and it's not that evident on all the international aspects that has been highlighted concerning this, is that there are two components to provide the human right to water. One is the concession of water or the rights to water, and the other is the service. We have problems in these two aspects, besides another one that I'm going to mention at the end, and is outside of the water field. So in order to, while my colleagues and many, and I must say that many people from the academia and from the ONGs are the main ones trying to find a consensus among them on how to move forward in this direction. While they were discussing all these aspects, we decided with our president to release a decree. This decree was signed 1 year after the president took his positions, and it is a decree that is guaranteeing 100 liters per water per day to every person. So they have the right there, and now we need to work in the service. I will come back later what we are doing to that. But the problem is that in many countries, it's not even the service, it's the right to have this water somewhere reserved in the nature in order to get use of it. And honestly, this figure of 100 liters of water per day, it was a figure that I defined myself based on these amounts that have been presented in some international literature, pointing out a quantity of 50 liters per person per day. So we decided to give a little more in order to allow persons as well to have some water to grow crops. Presently, now in Mexico, we have 7 million of people without access to a normal service. The first thing that we also did is to analyze the component and why these persons didn't have water in the service in water and home. And you start finding a lot of reasons that are very different in solutions. For instance, many of these persons don't have water simply because they cannot afford the energy bill. So it's not a problem that they don't have the services, they don't have pipelines, they don't have everything that is needed. They simply cannot afford the energy cost. So for that, the solutions is very different than thinking of providing water, rainwater, or providing different options. So if you start understanding the different reasons why people don't have water, you can implement different solutions. That is why we also have a program of subsidies, and we changed the rule of these subsidies in order to make affordable the support to the people. For instance, these subsidies used to say that the government granted 50% of the cost of the water services, and the 50% of the cost had to come from the community. Some communities are very, very poor. And in that respect, we changed the rules in order to allow the government to provide up to 90% of the cost, and the other 10% is acceptable to be provided working through people to working. And that has allowed us in this year, I don't have the figures for the past year, but this year we are serving now. Once we have granted water rights, we are working on the water services solutions to serve 216 localities of 135 municipalities of the most poor persons here in Mexico, because we are also putting in our program more emphasis in the poorest part of the people. So we're investing in all these people, and it's new for our country. We have not only the problem of indigenous people that we knew we have the problem, but some kind in relatively recent years, we have discovered that we have problems with Afro-Mexican communities that simply were at the end of the poorest. So we are starting working with all these communities with a different budget. So to finish, I would like to say that there are many obstacles to provide the right to water, but the main obstacle I have seen is in the mind of the people, even in the mind of the people that are supporting the human right to water, because people start complicating these issues. For instance, I was listening to what Callum said. So sometimes you want to provide one part of the things he mentioned, you want to provide the water services, and then you have people from different backgrounds start saying, no, you cannot bring that water because there are endocrine disruptors in there. And people start making a lot of complications, and we need to understand we need to go step by step, using the means that we have, and to try to advance in a forward position and always to improve. It's not that we are going to give the right to water and that the problems with water will end there. We will need to improve the services step by step. That would be my contribution. Thank you very much.
Thank you very much, Blanca. That's really, really interesting to hear especially from your personal view. I think that's the point that you make, that it's essential to understand the reasons why people haven't got access to water. It's not just enough to decide to give them access. So we can maybe take some understand more in the questions later. And then moving from Latin America to the African continent, I'd also like to introduce Maureen Mwadime from the Kenya National Commission for Human Rights, based in Nairobi. Maureen is an advocate at the High Court of Kenya and a senior human rights officer. So Maureen, I understand that you're going to give us a presentation. Please go ahead.
Hello, everyone. I hope I'm audible enough. Yeah. Yes, I'm Maureen Mwadime, and I feel honored to be here speaking in the midst of professionals. I hail from Kenya and work for Kenya National Commission on Human Rights. I have a very brief presentation so that we can be able to move together. Very quickly, KNCHR is an independent national human rights institution established by the Constitution with the mandate to promote and protect human rights in Kenya. On the topic in discussion today, it is worth noting that Kenya is a water-scarce country, and there is therefore intense competition and water use conflicts by water users as a result of their different interests in the water. So 10 years down the line, what exactly has been happening in Kenya? At the international level, Kenya has ratified the International Covenant on Economic and Social Cultural Rights. We are also part of the nations that are fulfilling the Millennium Development Goals as well as the Sustainable Development Goals. Closer home, we have the regional instruments or frameworks, such as the principles and guidelines on the implementation of economic, social, and cultural rights in the African Charter on Human and People's Rights. At the national level, we have the Constitution that we promulgated way back in 2010. The Constitution has very express provisions on the right to water and sanitation. After the promulgation, we have enabling legislations that were put in place to actualize the provisions of the Constitution. And some of these legislations, the Water Act, the Public Health Act, the Environment Management and Coordination Act. We also have several regulations, policies, strategies, and plans, all put in place to enable the realization of the right to water and sanitation. So we have this very broad, robust legislative framework. And I think the question that we are trying to ask ourselves is, well, what exactly do we get to find when we come to the ground? Well, in a report by one of our partners, Kenya Institute for Public Policy Research and Analysis, by 2015, Kenya had missed the targets. We were supposed to have 40% sewerage, 80% water, and 76% sanitation coverage as per the MDGs. Unfortunately, we did not attain this. And in areas serviced by water utilities, accessing safely managed drinking water reached 58% in 2016, with 68.3% for urban and 50.2% for rural areas. Sewerage coverage was estimated at 15% of the population in urban areas, while the overall access to improved sanitation in both urban and rural areas was below 40%. Fast track this to 2019, we have the Joint Monitoring Program report by World Health Organization and UNICEF that found that only 59% of Kenyans have access to basic water services and only 29% have access to sanitary services. If you're to compare the figures in the year 2016 and 2019, you can clearly see that not much has transpired between the 3 years. Now, if Kenya is to be able to attain the MDGs by 2030, then we have a lot to do, because we are still at 59% when it comes to access to basic water and 29% when it comes to access to sanitary services. There's progress that has been made. Because of time, I've sampled just two. Within the Water Act, there is an institution by the name Water and Water Services Regulatory Board that is mandated to set policies for the water sector and also handle complaints from water users and its licensees. The challenges with this is that we have inadequate capacity by right holders to be able to claim their rights or even engage with the processes. And also we have several unlicensed water service providers to fill in, who have cropped up to fill in the gap that exists in service provision. Worth mentioning, over the last few years, 2015 to 2018, we've seen an increase in terms of budgetary allocation to the sector. However, it is also important to note that only 2% of the national budget has been allocated for the water and sanitation sector. Probably this can be attributed to competing priorities such as health, education, infrastructure, security, amongst others. The other issue is the low absorption rates, again attributed to issues to do with the complex or inflexible procurement government procedures, as well as delayed disbursements from the National Treasury. Even more worrying, the figures that only 9% of the water sector budget is set aside for the sanitation sector. We also have an issue when it comes to corruption. Again, this is an issue that has been bedeviling the country for quite a while. And all these challenges coupled together definitely make enforcement and achievement of sector targets almost impossible. Winding up my presentation, I think this is an opportune moment for us to be able to implement a framework for monitoring the realization of the right to water and sanitation. I have captioned it on the left side of the screen. The framework was jointly developed by KNCHR, Ministry of Water, Ministry of Health, Ministry of Devolution and Planning, Water Services Regulatory Board, amongst other stakeholders. And we were heavily supported in terms of technical support by the World Health Organization. The framework will ensure targeted and more inclusive interventions so that no one is left behind. Worth noting, the framework is built upon the principles of human rights-based approaches of participation, accountability, transparency, human dignity, equality, empowerment, and the rule of law. Thank you so much.
Thank you, Maureen. Can you share your screen, please, for us? Thank you. I really appreciate hearing some of the work that you've been doing in Kenya, especially with the development of the monitoring framework. Interesting that such a small percentage is spent on sanitation too. It's as big or bigger a problem in some areas. And so thank you for that. And I'd like to introduce our next guest, moving a little bit from national to regional approaches. We're introducing Sergio Campos, who has the benefit of looking at a range of solutions from across the Latin American continent. He's currently responsible for the coordination of the Spanish Fund for Water and Sewage in Latin America and the Caribbean, as well as the restructuring of water and sewage projects for the IADB. We look forward to hearing from Sergio about the strategy that the Inter-American Development Bank has adopted when looking to improve human rights. Thank you, Sergio.
Good morning, Amanda. Good morning, everybody. Good afternoon or good evening. It's a pleasure to be here. I want to first thank the Human Right to Water for organizing this event. after 10 years of the Human Right to Water and Sanitation Declaration, and 10 years into the, we achieved the SDGs, or we review the achievement of the SDGs. I think it's important to, it's a good opportunity to reflect on where we are here, no? Particularly because the human right to water has been the building foundation of the SDGs. And then it's, as Callum mentioned, we cannot avoid talking about COVID. And if there's something that COVID has done is underscore the importance of having access to water and sanitation in lines of the human right to water, available, accessible, safe, affordable, and acceptable. No? Worldwide, the prevention, or the most cost-effective prevention for COVID has been hand washing. But having soap and having water, it cannot be taken for granted. As Callum has mentioned, there are many illegal settlements, favelas, illegal settlements that don't have access to safe water and probably don't have access to sanitation. So assuming that, it's a big assumption. And particularly in Latin America. Latin America, it's a very privileged region in terms of having access to fresh water. We have 1/3 of the freshwater water resources in the world, but water is very unequally distributed. Regionally, I mean, if you compare the access to water between countries, Mexico is very different than Argentina, Haiti, Honduras, and Bolivia. There are huge differences there. When you compare the poor and the rich, the two lowest quintiles, the poorest of the people, they don't have 75% of them don't have access to safe water, and 85% don't have access to sanitation. It's not the same to live in Bogota, Buenos Aires, Mexico City, or in the rural area. And the gaps and the differences between access to water and sanitation are very proof. And the truth is that this pandemic has taken us by surprise and unprepared. Our water infrastructure is vulnerable to climate change, and our water and sanitation infrastructure is very inefficient. We lose almost 50% of the water we produce. So we were not ready for this pandemic, as we're not ready for the effects of climate change, droughts and floods, like the one that affected Sao Paulo, or the one that affected La Paz, almost similar to Cape Town. So there's a lot to do in terms of materialize the human right to water and sanitation, to reach universal access, to achieve the SDGs. Not everything should be a criticism. It's more highlighting the importance and the challenges that we have ahead. The truth of the matter is that Latin America has made great progress. We were able to incorporate more than 220 people to access to safe water and sanitation over the last 15 years, but much more needs to be done. And then the truth is that the human right to water and sanitation has been instrumental for Latin America to make progress. Almost 16 countries, or more than 15 countries, have acknowledged the human right to water and sanitation, 9 in their constitution, and some others in different legal frameworks. Among the champions, of course, Mexico, Bolivia, Peru, Paraguay, Costa Rica, more than 9 countries have the human right to water language in their constitution. So what has been the bank's strategy in able to advocate and promote the human right to water and sanitation? We worked in 3 areas, mainly, as Blanca was saying, changing or trying to change the minds of the people, trying to incorporate that. No? But first, we started supporting countries, either with technical cooperations or with loan, but also with knowledge products, and also bringing or creating a coalition of institutions. And in that, we were very thankful and we're very honored to have advocated the human right to water and sanitation with the government of Spain, the government of Switzerland, our members of the Aqua Fund, is a designated fund for water and sanitation, as well organizations like CONAGUA, IWRA, COE, and of course you. So that was the first approach, gathering all other parties, advocating the concept through loans and TCs. And in doing that, we focused first on developing tools, demystifying the concept, We've developed a manual explaining in a basic language what does entail the human right to water and sanitation. And with CONAGUA, we worked on that. And the third approach was supporting the implementation of the human right to water. And in that, building capacities like in CONAGUA, helping CONAGUA train their staff, but more importantly, defining indicators so that we can track the progress that we made. That was one achievement or one example. Second, carrying a survey with regulators so that they can understand and embed within their regulation the different concepts of human right to water realization, maybe without needing to mention the human right to water and sanitation. Promoting best practices like the creation of the Brazilian national planning document that underscores and embodies the human right to water and sanitation. Promoting social tariffs for vulnerable populations so that water is affordable and there's a minimal level of consumption that can be respected for their dignity. And bridging the gaps through community participation in creating access, like the Agua Más Trabajo and Cloaca Más Trabajo from Argentina, from Peru and Paraguay, as well as trying to acknowledge the gender unbalance, the use of public bathrooms, and how can we provide safe access to water and sanitation through illegal settlements. No? And in that, we're very proud of having developed a second manual that underscores 50 best practices of how the human right of water and sanitation can be implemented in any countries. No? I'll leave it at that, and more than happy to address any questions. Thank you.
Thank you very much, Sergio. A lot of information there, and it sounds as if you're working at all levels and very supportive of the progressive realization across the region. And I'd like to introduce our final speaker now, Léo Heller, the more prominent persona in the agenda for realizing human rights to safe drinking water and sanitation as Special Rapporteur. I'm looking forward to hearing his thoughts on how the last 10 years have progressed with respect to the realization of these rights and some of the learnings and good practices that he can share with us.
Thank you, Amanda. Good morning, good afternoon, good evening for everyone. I faced some problems with my internet connection, but fortunately now I'm back again. So first of all, I would like to congratulate the Human Rights to Water for this webinar. This is a very important discussion, particularly celebrating the 10 years of the resolution. And also to say that I'm very happy to hear the cases that the previous speakers showed to us. So it's very important for IWRA to connect science and policy, aligning this connection with the human rights to water and sanitation. It's very good to hear from Blanca that CONAGUA also is aligning its policies and practices with the human rights framework. Kenya is a very emblematic country because it included in the constitution early in 2010 the human rights to water, so it was a very interesting example. Of course, there are challenges to make it real, and good to know also from the bank, Inter-American Bank, that, and I'm following the work of IADB on increasingly including the human rights framework on what the operational of the bank. So I very briefly would like to introduce a project that I'm developing in my mandate. It's the mandate of the Special Rapporteur is supposed to visit 2 countries per year and to undertake an assessment of the realization of the human rights in the countries. I did 9 visits so far, and this project is to follow up the recommendations of the visits some years later from the visits. So I last year assessed 4 visits, 4 countries: Tajikistan, Botswana, Portugal, and El Salvador. And this year I'm completing this project, assessing 3 other countries, 3 more countries: India, Mexico, and Mongolia. And looking back to the reports of last year, I can see that obviously there are some challenges to achieve the recommendations. It's not easy, particularly when there is a short time in the period, but I would highlight some interesting progresses that I could assess during this exercise. The framework of the project is to compare the status of the recommendation in the exercise of the follow-up with the visit itself, and to classify this status in 6 categories. So the first category is good progress, the second is progress ongoing, then limited progress, progress not started, unable to assess due to lack of information. Unfortunately, some of the recommendations fall in this category. And the last category is retrogression. Unfortunately, I have few issues of retrogression, not many, but few are in this way. If I look these 4 first countries and use a very simple criteria to select countries that have some interesting performance, using the proportion of the first category, good progress, within all the recommendations, Portugal and El Salvador have some interesting progress. Not fantastic, I need to say, because there are several gaps, but I can realize that some of the recommendations were very well taken, and good progress can be assessed. I don't always have the caution to say that the progress not necessarily is due to my visit, because the dynamic of the country can be a driver for some progress. And for instance, in Portugal, one of the recommendations was to monitor the process of granting concessions and how these concessions are impacting municipalities, both in financial and other burdens for the municipalities, because there were some experiences where the concessions were not so very well planned and the impacts were not interesting for the realization of the human rights. And then the country responded to my questionnaire, saying that the regulator is monitoring closely those processes of concession, and also that there are some changes in the national legislation in order that the concessions align better with social outcomes. So this is one example. A second example from Portugal is a recommendation that affordability should be included in the legislation of the country, because there were some initiatives in terms of providing more affordable services to people living in poverty. For instance, there is a measure of social tariffs in the country, but the use of the social tariffs were not obligatory. It was more voluntary, and this was a concern that I realized that the population of some people from Portugal had. And some years after, the legislation included an automatic application of the social tariffs by the municipality. So this was a very interesting progress related to affordability. In El Salvador was another interesting case. One of the recommendations was related to finalize the national plan of water and sanitation in the country, and to align this national plan with the human rights framework. And the national plan was finally completed, and it was a very interesting progress. And there are some alignments of the national plan with the human rights framework, not entirely, not fully, but some alignment was there. And I need to congratulate the country about the completion of the national plan, but at the same time, in my report, I encourage the country to align better the national plan with the human rights framework, and also with the SDGs, both SDGs SDGs 6.1 and 6.2 that are not very well reflected in the national plan. But anyway, it was a very interesting progress to have a plan. In my view, planning is a very important instrument to guide policies and practice in terms of the human rights framework. So just to say that this follow-up project is a very interesting way to assess what we call the progressive realization of the human rights in each country. That is something not very easy to do, but this is a clear example on a way to assess the progressive realization. And I'm very happy with this exercise. It's not easy to do that because there is a lot of work involved together with the other activities of the mandate. But I think this could be an example for other mandate holders in the special procedures of the human rights country to follow up recommendations of the country missions. So I will stay here and thank you for the opportunity.
Oh, thank you very much, Leo. And it's good to hear that there is some progressive realization over the last few years, and that you've actually been able to see that. I think we have time for a few questions, not as much time as we planned, but we'll see if we can deal with a few of them. And I'd like to open them to all the panelists, and perhaps some of you can volunteer to answer. If I ask a few of the questions, and then we can see if any of them can be answered easily. We have one from Desigan Naidu, which is around why not a free basic needs allocation like in South Africa. I think that was in reference to the comments made by Mexico. We have another from Dinesh Suna from the Ecumenical Water Network of World Council of Churches, asking around affordability. I don't think it's so much a question as a comment. And secondly, on privatization of water and how we can manage to look after the more vulnerable people. That question was also addressed by Neil Dr. Abakwa, or something similar. And then we have a question for Kenya on the devolution in the water sector and management of water locally. So I think there's a few questions we could get started with there. Perhaps if I could ask the panelists you can reference the questions on the Q&A yourselves if you'd like to read them, but would anyone like to comment on any of those points? The one was on the availability of free water, one was on affordability, the management of water locally, and of the inclusion of the private sector.
I can start addressing probably two of those questions. The one on water for free. One of the biggest challenges that we have faced in Latin America in supporting governments, that all the governments support the human right to water, to sanitation, but it goes beyond the pricing. But in some cases, it was understood the human right to water as water is free. And I think that we all agree that there needs to be an adequate subsidy and an adequate pricing. It needs to be affordable for the people that cannot afford it. But there are a lot of people that can afford it and that they sometimes don't make a rational consumption. And I think it will not be adequate not to price it well, on one hand. On the other hand, access to water and sanitation is so priceless that I think it needs to be self-sustained so that it can last for good. Resources are going to have to come from one end or the other. And this is so priceless that it needs to be somewhat sustainable. No? And let me stop there.
Thank you. I think Blanca had an answer as well. Thank you.
Sorry, I didn't. Sorry to Sergio, but I interrupt him without wanting to do it. So, two questions about privatizations concerning the poorest. I think there is no place to privatizations in the sense that it's not affordable. They cannot take. There is no way for the private people to have incomes from that. So for me, for the poorest, it is a matter for the governments to do it. And in that respect, I would like to describe how the way we're doing things in here that has to do with consultations and with working together with people. In many cases, our president, instead of making consultations, he simply allocates money to the poorest people, and they decide what they want to do, and they can decide that they want to put money on water, or they want to put money on agriculture, on different things. Somehow, and I think it's giving a lot of success because it has to do with sustainability. Normally, when we do consultations in the water field, we go to the people and we say, which type of technology do you want to have? From where do you want to take water? And here is more broad. It's about what do you want to have to improve the way of life. And when they pick water, they really take care about water. So they put all the money on water, or they put the money in different things. So it's a very different approach. And I think that it's taking us to look the way in which we are providing water in a different way. I don't know if you have a little bit more of time, but I want to come, because I hear of what Leo says, and I really would like to invite him to make a more in-depth analysis on the reasons why people don't have water. Because giving a score to the countries, it's very stressful, but it doesn't help people to look to the solutions. In many cases, for instance, in Mexico, we don't have water, not because we don't have provided the services, simply because there are areas where the drug dealers, where illegal logging, where the human traffic is being very important. And so for all these people to be covered and to be protected by the people, they break down all the water services and start providing the services of the government themselves. So people protect them, and that is happening in a lot of countries. Many have not realized it, but there is illegal mining. So all these people take in their hands the provisions of all the different services, protections, water services, electricity, and the regular people protect all these bandits, if I may say. So this type of reasons is a reason that could be very difficult to readdress, doing consultations, providing good technology, which is more theoretical. And with that, I will end. Thank you.
I think this, the whole community-based decision-making approach is very important. Leo, I can see you're itching to respond to that.
No, just quickly reacting to Blanca comment. I'm not giving a score to the country. I'm just assessing how the recommendations are implemented. And the recommendations are based on evidences collected during the visits. They are not abstract. And Blanca, looking forward to the government of Mexico responding to my questionnaire to see the follow-up of Mexico, very grounded in evidences for you. Very quickly, just a comment on affordability. Affordability, I think, is a very, very relevant element of the human rights to water and sanitation. I think one of the most challenging elements of the human rights to water and sanitation. I devoted a full report on this issue. If people are interested in having more information, please go to my webpage and go to the report. But some few elements on that. First, people that have the less affordable access to water and sanitation is people unserved or underserved. This is very important. The best way to provide more affordable access is to provide services to people. Not necessarily collective services, but services. Because if people go to the river to collect water or go to the field to defecate, it's unaffordable in several senses. Second, when there is collective services for water and sanitation, there is a challenging to think on the best way to protect the people living in poverty. It is not really correct to say that the traditional way to collect tariffs, the so-called increasingly block tariffs, is fair and is affordable, because most of the time people living in poverty consumes more water than people that rich people. So the increasing block tariff is not fair in many circumstances. So it's very important to think on ways to protect the quintile that lives in poverty in order to, through several mechanisms. Social tariff is one, different types of subsidies are others. And one of the challenges is how to identify people in need for these types of protection. So I will encourage you to think more on this challenging, on providing affordable services to people, because I think that this will be even more challenging in the post-pandemic. The economic crisis will put more people unemployed, precarious employment, and needing for protection from the state to access water and sanitation services. Thanks.
Do I have any more responses from the panelists on those subjects? Maureen, please. Maureen?
Okay, thank you, Amanda. There's someone who has asked about devolution and the right to water and sanitation, and whether the same has complicated the situation. Well, if I may draw the example of Kenya, well, the two-tier system of government in Kenya recognizes that when it comes to policy setting and water resource management, well, that is done at the national level. When it comes to water and sanitation services, that is done at the county level. While we may also to be doing what, who's supposed to be doing what, there's a very huge concern that structures that have been put in place by the national government and handed over to the county government are generally mismanaged.
I think we might have lost Maureen. Is anyone else in the same? And Maureen, we're losing you. I don't think your video is holding up to it.
This has generally been attributed to lack of. Hello, can you hear me?
You're back. We can just hear you. We can't see you. Just finish quickly, Maureen, because I don't think it's a good line.
Sorry?
I think it's a very bad line. So if you could just wrap up what you were trying to say.
Okay, very quickly is that, well, devolution has its own pros and cons. To begin with, there is definitely the issue about bringing the resources closer to the people, and the county government has always been something that we are trying to grapple with. That is one. And the second thing is that, well, resources are all at the national level. So when it comes to disbursing the resources for development projects, again, there's always have then.
I think we've
found about lack of prioritization.
Okay. Maureen, I'm so sorry. We can barely hear you, but I think we're getting a message through about the that you're trying to say in terms of bringing the resources closer to people. And I think the messages that have come through in general today have been very much around community-based decision making and finding solutions that are going to bring access to people, such as affordability, and really trying to think carefully about what is driving the lack of access, particularly for vulnerable people and the very poor. And the country examples we've had have been quite different, which is interesting. I'm really grateful. We're coming to the end of our time, and I'm very, very grateful to all of you speakers and panelists for your time today and sharing your experience and knowledge and your making yourselves available to talk to us in such a frank and open way. I wish the Q&A was longer. It always ends up like this. We might have to have a longer session next time. So thank you so much to all of you. It's been a real privilege to work with you today, and I'm really looking forward to following up on this. We will follow up on questions that haven't been answered. I'm going to speak to the panelists and see if we can answer them for you online. And then we hope to look forward to seeing you next month for our next webinar, which will be around public-private partnerships and the need for a human rights-based approach with those types of organizations. So thank you to everybody very much for joining us today. Thank you.
Thank you.
Thanks
Bye-bye,
a lot, everybody.
everybody. Nice to see you.
Thank you all.
Thanks.